Hello, and today's video is on how to make a temporary single unit posterior crown. This is probably one of the more routine things we do here in our office, and just going through the steps I think will help clarify some of the objectives that we're trying to accomplish in doing these crowns. First of all, whenever we're doing a crown, it needs to meet some basic criteria. There's actually four top things that I've listed here. Is that it needs to actually replicate and look like a natural tooth. It needs to just blend into the oral dentition. Second, the margins need to be sealed. Third, the interproximal contacts must be in contact so they don't allow food to get packed in there. And fourth, the occlusal contacts need to be there, but they just need to be light in occlusion. All of these things will help keep the prep tooth in its proper position and not allow it to drift around while we're waiting for the final crown to be made. When we look at a prep tooth with the preliminary impression material, the PBS material placed over it, if we were to take and cut that in a cross section, you'd see how the prep tooth fits within the preliminary impression. So the very first step when we're doing a temporary crown is we need to get a good very good preliminary impression. So you can see in this example we use this material called Blue Bite, and we fill it inside of this thing called a saddle tray, and we place it in the mouth, and what we get is a very nice preliminary impression. And one of the keys when you're putting this in is to go directly down on top of the teeth and not slide in from the side, and have the patient bite down so it's a nice vertical pressure. It makes for a very nice preliminary impression. The nicer the preliminary impression, the better your temporary, or at least a lot easier it's going to be to make that. And it's best to have it centered both buccolingually and mesial distally over the target tooth. And when we remove it, well, it looks like that. And so what we're looking for is no smears, no tears. We want to have the gingival margins should be well defined. And just make sure the neighboring teeth as well are intact. Sometimes you'll see little fins of material that have gone between the target tooth and the one next to it, and I just simply pick those little fins out. That'll help prevent creating an open contact. So now we have a preliminary impression, and the prep has already been taken care of. The impression's been taken care of. Now it's time to make the temporary. You can use any material you want. We use a BIS acrylic material. There's several of them out on the market. This just happens to be the one that we use. Squirt it out of the gun. Of course, you do like any kind of mixing tip type material. You're going to squirt a little bit out on a 2x2 first, and then express that material inside the preliminary impression. The key point when you're putting this in is to put it down onto the occlusal surface and then just steadily start expressing the material. You don't want to take the tip out of the material and then go back in and back out and back in and move around. You want to try to keep it as steady as possible so that you don't incorporate air bubbles into that mold. Okay, and then you simply put it back in place. You have a few seconds of working time, and then when you take it out 2 minutes later, the temporary is either going to be inside the preliminary impression or it's going to be stuck to the tooth. If it's inside the preliminary impression, you're going to have to pop that out. Try not to dig from the buccal or the lingual with a spoon. Instead, try to come in from either the mesial distal, go right underneath the occlusal, and pop it up. Sometimes you actually have to take the tray, although in this case it's going to be kind of difficult with the sides, but you have to sometimes peel the buccal and lingual, kind of peel them apart in order to gain a little space and maybe pop the temporary loose inside there, and then you can more easily pull that out without distorting or breaking the margins. Now, if indeed it does stick to the tooth, then we have to wiggle that off. And I found that just simply using a hemostat with real light pressure, I can just wiggle it back and forth buccal and lingually, and it will release and just come on out. Okay, so now we have this temporary that needs to be trimmed. One key thing to do is when you're finished separating the temporary from either the tooth or the tray, put it off to the side and go back inside the mouth and clean up any extra debris. We find a lot of times there's flash that gets over onto the occlusal surface of the other teeth. It gets into the interproximal spaces. Take this time to go ahead and start cleaning that out. If you don't, you may forget later to do it. So do it at this point. Make sure it's a nice clean environment. Plus, while you're working on your temporary, the patient's not going to have little bits and pieces of extra temporary flash material in their mouth. Okay, so now we have this temporary, and as you can see, there's usually an excess amount that spills out over the margin. And it's this point here that we need to trim the margins. And when you're first doing this, it's a little bit tricky to see where they are. But if I were to hold up an untrimmed temporary, and then in this next picture you can see I've put a really faint red line that kind of indicates where the margin is. And you just have to look at crowns after a while to kind of get an idea where that crease is in the margin, so you know right where to trim. And so if you take a look at this picture, I have one that's pre-trimmed and post-trimmed. You can see the difference. And always keep in the back of your mind, this temporary should look like the final crown. And once you handle quite a few final crowns, you know the general shape of them. And so this temporary needs to mimic that, especially when it comes to the margins. They should be nice and smooth. If you're a beginner and you're doing this, sometimes it's helpful to take out a little mechanical pencil and trim that little crease or that little crevice where the margin is to help you visualize it when you go into trim. Now, when trimming the margin, there are a couple different schools of thought on how to do it. I find that using simply a high-speed handpiece with a carbide football finishing burr is the best. I do not like using diamond burrs for this. I feel it scratches the material too much, and also in my hands, an acrylic nose cone is just too big and unwieldy to make a nice, smooth, defined margin. So as you can see, I'm going to start trimming off the excess, kind of working 360 degrees around the perimeter, of course making sure I'm not touching the interproximal contact. We'll get to that in a moment. But just kind of trimming along, little finger brush strokes. If you notice, I'm resting my fingers from my left hand against my right hand. It allows for just nice, smooth pushing and pulling movements or motions, kind of like a paintbrush approach in reducing the excess temporary material. Okay, so now we got the perimeter, this margin taken care of. Now it's time to take care of the interproximal contacts. A lot of times when we put these temporaries in the mouth, when they set up, when you take them out, that interproximal contact isn't nice and convex. It actually has this little fin of material going around buccal, lingual, gingival, occlusal, all the way around, and that needs to be taken off, because you can imagine that would get things would get hung up, or things would get stuck. If you try flossing, it's going to get hung up on that little lip. So you need to trim that off, but you have to be careful not to trim the actual contact itself. So I've put here a red circle showing where the interproximal contact is located, and you want to stay away from that. Trim everything else around, leaving the interproximal contact there. If you take it away, what's going to happen? You get open contact, food gets stuck in there, and maybe the tooth could shift around while the patient's wearing it. So again, if you're a beginner, you can simply take that pencil again, pencil the contact area, and then when you trim, you just know don't hit the penciled area. And then when you're finished, you'll have a very nice contact. Again, just kind of trim around, make your way around 360 degrees around that contact, and then that should be just fine. So now you have it finished, and you're going to put it on the actual tooth and inspect it. Does the buccal margin, does that fit? Does the lingual margin, does that fit? Take a look at the occlusion or the contacts there. Do they look nice and smooth? And when you look at it, just kind of looking from the anterior to the posterior, does it look like it belongs? Does it look like it's too bulky, or does it look like there's a piece that's kind of dished out? You know, just kind of doing an evaluation to see if this actually looks like a crown in the way it should fit. You can even, of course, when it's out, test it with an Explorer. And then you can even test it with floss to just verify that you do have contact. And when you do put the floss in, take the floss and pull it out towards the buccal. If you pop it up occlusally, the temporary will probably come off with it, and then you're going to have to go try to find it. Hopefully it didn't go down the patient's throat. Now, you got this temporary, it's trimmed, it's ready to be cleaned and ready to be processed. Before we can put it in the mouth, we need to go through these steps. I do them in this particular order. I clean it with alcohol, I polish it with some kind of polishing wheel, sandblast, wash, dry, and now it's ready to go. So we take it back to the lab and we use this antimicrobial disinfectant spray. Using my gloves at that point. Once that is cleaned off, I can now take off my gloves and just use it with my bare hands, especially when I'm going to be using a polishing wheel. If I use a lathe, I definitely am not going to be wearing gloves at that point, and so that's why I'm using no gloves here. Now I'm using alcohol on a Q-tip, and I'm actually going to go and spin that Q-tip around and to remove that kind of greasy, slimy layer that we find sometimes on these bisacrylic temporaries. That's just going to get rid of that. Next, we're going to have to use some kind of polisher. You can use a handheld electric handpiece with a polishing tip on it, or you can use a lathe. I personally kind of like the lathe because I think it does a job, it gets the job done quicker, but I'm okay using either one. For this video, I just went ahead and used the electric handpiece. When we're finished with that, take it over to the sandblaster, and we're going to sandblast the interior of the crown for about maybe 2 seconds, 3 seconds or so. And then once that comes out, wash and dry over the sink, inspect it to make sure everything looks nice and clean, front and back, and now we are ready to go to the mouth and put it in. Treat this like you would a final restoration as far as keeping the tooth nice and clean and dry. Sometimes we actually paint an antimicrobial on the tooth before we cement it. Of course, we dry that because you want to make sure that the surface of the tooth is dry, the internal surface of the temporary is dry, so you put the cement in there, it all comes together, and it's going to stick really well. And we just happen to use Duralon or temp cement on our temporaries. Okay, that's basically how a straightforward temporary would work. Here's a couple of other slides and photos and videos showing some things that kind of go awry or some problems that you may run into. If you have a bad preliminary impression, like you'll see in this example, it is smeared on the buccal surface. My suggestion would be is take that, throw it away, and try again. If you try to make a temporary using this distorted model or impression, you're going to find you spend a lot of time trying to get it just so, or just trying to make the tooth look normal. This temporary material, this blue PVS material sets up in 45 seconds. So chunking that in the trash, getting a new saddle tray, loading it up, and getting a more accurate imprint will save you tons of time and end up giving you a better product. Another thing you don't want to have is an open margin. That was one of the top 4 things that we're looking at when we're doing a temporary. You don't want to have an open margin. And if you leave it like this, the patient's going to have sensitivity because the dentin underlying it, or at least the thin part of enamel, is going to be exposed. I've seen assistants try to patch this up with some flowable composite or pack something in there. That most of the time doesn't work. It's just best to realize that you messed up, take the temporary, put it aside, get your preliminary impression, and just start over with a brand new temporary crown. That's going to be the best way to go about it. It's going to have less post-op problems with this patient, and although yes, you've already put quite a few minutes of time into this, it's just best to start over at that point. Here's a real clinical example of a patient who had an open margin on their crown, on their temporary crown, and then they came back and got the final crown. And yes, I know the shade doesn't match on the final crown. They were going to be getting some other work done on those other teeth later, so that's the color that they wanted. Anyhow, the point of this slide is to show what a real crown looked like, or what it should have been as far as covering the full extent of the margin. Here's another case where the patient was packing food because it looks like the temporary was too aggressively trimmed on the mesial and distal, creating an open contact, allowing food to get packed in there. You can see this exact same model. I take the final crown, put it on the model, the contacts are closed. On the temporary, they're wide open. Here's an interesting case. The premolar, if you take a look, it does have a class 5 lesion up by the gum line. When you take your preliminary impression, when you take out that preliminary impression, you're going to have a little extra material that kind of dipped into that void. You're going to have to go into that blue imprint material and scoop away that amount, because if you don't, you're going to get a replica of that same divot on your temporary. The other way you could do it is, of course, before you slip your blue material in place, you can fill in that void with some composite or putty or something to just kind of block it out. That would be another way of doing it. But the problem we had with this case is there's the temporary. Temporary is short. It did not go all the way up to the margin because the temporary material never had a chance to go up there. The assistant never scooped out the preliminary impression, and so as a result had an open margin. There's the final crown in place. You can see the final crown goes all the way to the gum line, but the temporary didn't. So knowing what your preliminary mold is going to give you as far as ability to work with this temporary is going to be important to kind of think ahead on how that may work. And lastly, when you are putting in your preliminary impression, like I said, go straight down vertically. Don't slide it across the teeth. You're going to find that it's going to smear as you do that most of the time, so stay away from doing that. Also, when you take out your saddle tray with the impression, take a look to make sure that the sides are well adapted, that they did not come loose or that they're peeling away. If you do that, as you can imagine, the internal is going to be distorted. So when you make your temporary, that's a very good chance it's going to be distorted as well. So again, it just takes 45 seconds for that material to set, throw it in the trash, and start over. Anyhow, hopefully this video has been helpful in helping you make your temporary crowns. Look forward to your comments below, and thanks again for watching. Bye.